Good evening, my country people. I hope you have had a fantastic day. Mine too was fine. We are still back with our day-to-day educational bangers, and we are winding up our topic on muscle pull, and more specifically, we had a very important subtopic which was about muscle aches and muscle pains, or what we commonly call myalgia, and it's most common in elderly people. Myalgia simply means muscle pain which has an unexplained cause. Before I continue, let me appreciate those who are supporting this channel. You might be supporting it by subscribing, sharing the videos, liking, and also commenting. I'm glad I'm getting very positive comments, and this is why I'm not getting tired. I'm giving you bangers after bangers, as I promised since I started this channel. It's a journey we started together, and it's my hope we'll continue being together without getting tired. Common causes of muscle aches. Common causes of muscle aches. Often, people who experience muscle aches can easily pinpoint the causes of the muscle aches. For example, in elderly people, it might be because of old age. So, people who experience muscle aches can easily pinpoint the cause, because most instances of myalgia result from too much stress, tension, or physical activity. This means it can be due to too much stress, tension, or physical activity. Common causes of muscle pain or muscle aches include: number one, muscle tension in one or more areas of the body. Muscle tension in one or more areas of your body. Number two, overusing the muscle during physical activity. Overusing the muscle during physical activity. Number three, injuring the muscle while engaging in physical demanding or exercise. Injuring the muscle while engaging in physically demanding work or exercise. Number four, skipping warm-ups and cool-downs. Skipping warm-ups and cool-downs. What are the medical conditions that can cause muscle pain? It's a medical condition, and at the same time, it can cause muscle pain. Not all muscle aches are related to stress, tension, and physical activity. Not all muscle aches are related to stress, tension, and physical activity. Some medical explanations for myalgia or muscle pain include: some medical explanations for myalgia include: number one, fibromyalgia. Fibromyalgia, especially if aches and pains last longer than 3 months. Fibromyalgia, especially if aches and pains last more than 6 months. Number 2, chronic fatigue syndrome. Chronic fatigue syndrome. Number 3, myofascial pain. Myofascial pain syndrome, which causes inflammation in muscles, connective tissues called fascia. This causes myofascial pain syndrome causes inflammation in muscular connective tissues called fascia. That's why it's called myofascial pain syndrome. Number 4, infection. For example, flu, polio, or bacterial infection. This can also result in pain. Next point, we have autoimmune disorders such as lupus, dermatomyositis, and poliomyositis. Autoimmune disorders, for example, lupus, dermatomyositis, poliomyositis. Number 6, use of certain medication or drugs such as statins. Use of certain medications or drugs such as statins, ACE inhibitors, or cocaine. Number 7, hypokalemia or low potassium levels. Hypokalemia or low potassium levels. Number 8, thyroid problems. Thyroid problems such as hypothyroidism or hyperthyroidism. Easing muscle aches at home. Or what can you do to ease or relieve muscle pain at home? Muscle aches often respond well to home remedies. So these muscle aches can respond very well to home remedies. This means you don't need to go to the hospital for treatment if they can respond to home treatment. Some measures you can take to relieve muscle discomfort from injuries and overuse include. So what are the measures you can apply to relieve muscle discomfort from injuries and overuse of the muscle? Number 1, resting the area of the body where you experience ache and pain. Resting the area of your body where you experience ache or pain. Number 2, taking an over-the-counter pain relievers, for example, Brufen. Taking over-the-counter pain relievers, for example, Brufen. Number 3, applying ice to the affected area to help relieve pain and reduce inflammation. Applying ice to the affected area to relieve pain and reduce inflammation. This marks the end of our first video today. We will continue discussing or winding up this topic in our next video. So let's meet in our next video and let's keep the support on. Let's continue subscribing, liking, and sharing our videos.